First, let's welcome Dr. Nicholas Bodenheimer of Novant Health OB/GYN. Hey, Dr. Bodenheimer, what a pleasure to have you back on the show.
How are you? I'm glad to be back.
I'm awesome, and thank you for asking. So before we get started, how about giving our viewers a quick overview of your background?
Sure. So my name's Nick Bodenheimer. I'm one of the obstetricians and gynecologists at Novant Health. I went to undergrad at Gardner-Webb University in Boiling Springs, North Carolina. After that, I went to graduate school at Creighton University. Then I went to medical school at Virginia College of Osteopathic Medicine. After graduating medical school, I went to residency at New Hanover, and now I've been at Novant Health for 3 years.
Awesome. Several of our folks have come out of that New Hanover program.
They sure have.
That's a great program. So tell our viewers a little bit about Novant Health OB/GYN and your partners.
So right now there's myself, there's Dr. Thompson, Dr. Toller, Dr. Shue, and then Sarah Brown is our nurse practitioner. Dr. McCarthy works part-time, and we deliver obstetric care and comprehensive women's health.
Awesome. How about locations? You're several places.
There are, and we're continuing to grow. So right now we have our main office in Bolivia, right beside the hospital. We also have satellite offices in Leland, Southport, and Carolina Shores.
Wow, I don't know how you cover all that. Well, I know there's lots of topics that we could talk about today, but we're here to talk about breast health and especially early detection. So let's start with your recommendations regarding how early and how often should a woman or a man have a mammogram.
Sure, so there's a lot of different recommendations out there that you'll see based on what society you read. The American College of Obstetricians and Gynecologists, they have certain recommendations. The American Cancer Society has certain recommendations. The U.S. Preventative Task Force has certain recommendations. So I usually follow the American College of Obstetricians and Gynecologists. Their recommendations, kind of a broad overview for people, would be start at 40 and have a mammogram yearly.
Is that for men too? If they
just for women.
Just for women. And men if they are diagnosed with some sort of...
Right.
Okay, how about 3D mammography? That's available at Novant Health, correct?
It is. And
can you explain the difference to me between 2D and 3D?
Absolutely. So this is kind of a new technology coming out. It was FDA approved in 2011. So traditional digital mammography, you're looking at a single image of breast tissue. With the 3D mammography, what you're doing is you're using a moving X-ray and a detector to where you're getting multiple images. So the point of 3D mammography is to increase the cancer detection rate, decrease the false positive rate, as well as hopefully help with women with dense breasts to detect these lesions earlier.
Yeah, I was going to ask you that. I'd heard that with dense breasts, it's better to have the 3D. Is that?
That's what studies are showing now. So they're finding that 3D mammography works well in two different populations. Number one, women with dense breasts, and number two, women who have a high risk of breast cancer.
I see. Okay. Well, there's been a lot of talk about self-exams. First they want you to do them, now they don't want you to do them. What's the scoop?
So right now, we've moved away from the term self-exam to more self-awareness. So 10, 20 years ago, we taught patients how to examine their breasts in a systematic fashion.
Right.
We've moved away from that now. It's now knowing what's normal for your breast tissue. So for example, if you know you have cystic breast, then you know what's normal. So if you feel anything abnormal or outside of what's normal for you, then that's when you need to let your gynecologist know.
So if a woman notices a lump or is concerned about one of these changes, what should they do?
Call their gynecologist.
Call their gynecologist.
Yeah. What we'll do from there is take a history, talk about, when did you notice this lump? Have you noticed any nipple discharge? Have you noticed any skin changes? And then depending on the age of the person, we'll either order an ultrasound or a mammogram.
Okay. Well, I've heard women say they have had a nipple discharge. What would that look like? What would the recommendations in that situation be?
So again, it depends. It always starts with trying to figure out when did everything start and what it looks like. So a history and a physical exam. We look at a lot of different characteristics to try to figure out where do we need to go from there. Is it on one side or both sides? Is the discharge, is it milky? Is it clear? Is it blood tinged? Is it spontaneous? Do you notice it only when you express it? So we look at all those different characteristics to get clues as to whether or not what we need to do next.
You need to do.
Absolutely.
Well, of course, everyone's first thought is it's cancer. You automatically think you have breast cancer, but there are many other things that a lump could be, right?
Absolutely. So there's a lot of different benign causes that it could be, and that's why starting out with a history and a physical exam is so important. Things that it could be cyst, it could be fibrocystic change, it could be fibroadenomas, it could be intraductal papilloma, and all these are benign causes that we
So there's a lot of other things that could be.
Exactly.
So you shouldn't be afraid to pick up the phone and call
Exactly, exactly.
Well, how would you treat some of those other conditions?
So like I said, the first step, so let's say you notice a mass, the first step would be, depending on the age, doing the ultrasound or doing the mammogram. Based on that, the radiologist usually gives us a scoring system. It's a BI-RAD system. Depending on the degree of suspicion of malignancy depends on where we go from there. It could be anywhere from expectant management, just watching it, up to a tissue biopsy. And with those things, it could be either a fine needle aspiration, a core biopsy, or an excisional biopsy.
Well, let's say a patient comes to you and you think that further evaluation after like a mammo or an examination is needed. What would be the next step?
So after we get those results from the mammogram, again, depending on the scoring system that it was given, we would either recommend to watch it, we would recommend repeat the mammogram or repeat some type of imaging a little bit sooner than the next year, or it would be a tissue biopsy.
Okay. Well, it's this is good segue, because next we're going to meet our general surgeon and our plastic surgeon after that. But before we wrap up, let's talk about how to get in touch with you and make an appointment.
Absolutely. So our main office phone number is 910-721-4050. So anyone can call that and make an appointment with us.
And just ask for Dr. Bodenheimer.
You got it.
Well, thank you so much for being here again.
Thanks
it was
for having
great
me.
to have you, and I look forward to seeing you again.
Absolutely. Good to see you.